Blake, thank you for coming onto the show.
You're welcome.
If you don't mind me asking, what's your own relationship with anxiety? Was there a time where you personally dealt with intrusive thoughts, or has your work sort of shaped your understanding of them?
Yeah, I mean, I think like everybody, there's certainly been times in my life when I've had a lot of anxiety floating around inside it. And I would say intrusive thoughts, depending on how we define them, probably that's happening to me on a daily basis. So, I wouldn't claim to have intrusions to the same extent that people struggling with OCD may have them. But certainly I would say that I'm kind of regularly getting intrusions and often having all kinds of spam popping up into my head and trying to distract me really, I guess.
I think before we get on to the definition of intrusive thoughts, I think anxiety, if we look at it from an evolutionary perspective, was once a survival tool. But today it feels more like a burden for many of us. Why do you think it's so universal yet so misunderstood at the same time?
So I think the argument with anxiety is it kind of had this evolutionary sort of advantage to it that if you're sort of perceiving a kind of pending threat, it would be helpful to activate your fight or flight systems and kind of get you out of that situation. And obviously that works very well if you're faced with a saber-toothed tiger or something like that, but less well if you're dealing with sort of psychological stresses of an office job, for example. It's something we can all relate to. We all experience at different times, but it can be very, very problematic when your body's kind of geared up to help you get out of that situation. And actually physically, that's not something that's possible to do kind of in current times.
So do you think anxiety is almost like the body's sort of alarm system or warning system, where it's telling you, okay, the direction you're going in physically or sort of mentally isn't the way forward, and so we've got to stop, we've got to think, and we've got to get back to, let's say, homeostasis or our foundation? Would you call it, say, like an alarm system or warning system?
Yeah, so I guess anxiety would be a perception of threat that is about to occur either imminently or in the future. And that perception of threat then mobilizes your body to fight or to flee, I guess, depending on your personality type and the perception of the threat itself. And so that then leads to all of these sort of chemicals being released and adrenaline, and your body kind of, you notice a whole lot of sensations of anxiety as well too, in terms of butterflies in the stomach and dry mouth, spittiness, shakiness, and generally you kind of can feel quite physically revved up because your body's preparing itself to get out of that situation or to attack the threat. And if that's kind of occurring over a very, very prolonged period of time, obviously that's going to be experienced as quite unpleasant as well too. But, a small amount of anxiety, a reasonable amount of anxiety can actually be helpful. And so we sort of think about the inverted U performance curve. So if you have a little bit of anxiety in situations, that can improve your performance up to an optimal point. And after that, if you continue experiencing anxiety, that then becomes associated with a decline in performance from there.
Yeah, I guess anxiety could be utilized as almost a tool. I think, if you have a deadline, let's say for a piece of work or project, and you're a bit anxious about it, that can give you that sort of extra piece of energy to, just to get over the finish line almost. But if too much, then that can be also increasingly debilitating to both your physical and your mental health.
Definitely. And people often conflate a lot of these things too. So if you sort of ask people why they're worrying, they'll often say, well, if I didn't worry, I wouldn't pass my exams. And it's conflating the studying that you do, which is helpful, with the worrying, which is pretty much always not helpful, I guess. So it's true that feeling anxious can cause you to worry about a negative outcome like failing your exams, and being aware of a possible negative outcome can motivate some helpful behaviors that kind of cause you to engage in the behaviors. But it's the behaviors themselves that are helpful, not the worrying beforehand, I guess, which kind of leads to that.
So intrusive thoughts, are they the brain basically trolling us? Like, why do we even have these sort of thoughts that come across?
I mean, I would argue it used to be thought that intrusions were a kind of symptom of OCD. and that
Hmm.
people with OCD got intrusions and people without OCD didn't get intrusions. So that's how I was first kind of drawn into studying this. A number of researchers did some really interesting studies where they showed that everyone gets intrusions, or it's very, very common for people to have intrusions in the general population. And so we kind of know that intrusions are really normal phenomena. Um, and I would kind of argue even more than that, they're probably quite helpful to have. They're not necessarily us trolling or being trolled by our brains, but just it's quite useful to have different types of thinking. Daniel Kahneman, if you know the book Thinking Fast, Thinking Slow, he wasn't
Hmm.
talking about intrusions, but he was making an argument that there's different types of thinking in the brain, a slow way of thinking and a fast way of thinking. So if you walk into a supermarket and decide whether you want to get a chocolate milkshake or strawberry milkshake, your brain just quickly makes a decision and you walk out of there thinking, why did I get strawberry? I really prefer chocolate, but at least you've made a decision. And so you've got this kind of very quick firing decisions. Whereas if you're deciding whether to buy a flat or to get married or something like that, it's going to take a lot more sort of thought, and your brain's not going to like that because it's hard work and kind of you have to sort of drag your way through it. So if I asked you what's 76 times 43, you can't use a calculator. You could probably give me the answer, but your brain would not like me for that. Intrusions, I guess, are these sort of uncontrollable thoughts that pop up into our heads all of the time. They're really part of our imagination, I think. And the way the imagination works is that we can't censor it. Wouldn't be very effective for Stephen King to be writing horror books, but only able to think about kind of positive thoughts or kind of neutral thoughts. So really intrusions, we don't get to decide, do we get positive thoughts or negative thoughts or neutral thoughts? They're a composite of all of those things. And in the literature, and when people kind of complain about intrusions, we generally will hear about the really horrible negative thoughts that people have about standing at the top of the Eiffel Tower and throwing themselves off it, or shouting out something racist in public. That's kind of commonly how people think about intrusions, but really, I would say they're a lot broader than that. And a good analogy for this, I think, is like a spam analogy, so that our brains are constantly being bombarded with spammy thoughts all of the time. And most of the time, we recognize this and we filter out the spam. So it goes straight to our spam folder inside our heads. And we don't even really register the thoughts that much. But occasionally, every now and again, spammy intrusion will sort of work its way through into the front of our brains, marked high priority. You really need to attend to this now. And that's when they can start to trip us up if we take that too unquestioningly.
So, is there a relationship between intrusive thoughts and rumination? Where if, say, I have an intrusive thought, it's negative, and I keep on fixating on that sort of thought, and I go down this sort of rabbit hole where I'm constantly thinking about it. I believe that's the definition of rumination. How does one lead to another?
Yeah, so I think intrusions are often the hook into rumination,
Hmm.
because the ones that kind of don't go into our spam folder and that are threatening are usually ones that are anathema to us as people, or that really kind of bother us. So, pacifists might be really bothered by violent intrusions, for example. And so they kind of have a kind of personal sense of threat attached to them, the sort of negative intrusive thoughts that might spark off rumination. So if we think about like intrusions versus thinking versus rumination, intrusions are different from the other two categories because they're unplanned and uncontrollable, whereas thinking and worrying, or thinking and rumination, if you like, I guess are probably more controllable. How do thinking and rumination differ from each other? Thinking would be like taking the train from here to Glasgow. You might have a few detours and unexpected stops, but essentially you start at point A and you end up at point B. Rumination, you would travel the same 500 miles, but on the Circle Line tube. So you kind of go round and round and round. And if we want to torture this analogy a little bit more, I guess you can start out thinking about something. So
Hmm.
your first time on the Circle Line tube could be quite exciting. You get to see the names of all the places that you've heard about before. And so you start out thinking about something, but once you've done your first loop and there's no new information coming into the system, you're now starting to ruminate. And often that's accompanied too by a sense of anxiety as well.
So, I've been reading a bit of Freud, and it sort of begs the question: in how much control do we have over our thoughts? I mean, Freud talks about repressed memories from early childhood that could sort of dictate the behaviors that we do sort of a decade on. And so, do we really have control over our thoughts, or is it just sort of clouds that are just, you know, passing by almost?
Yeah, interesting question. So I think if we proceed with a definition of intrusions as uncontrollable or unplanned thoughts, then I guess we have very little control over intrusions. Where I would probably differ from what you've been reading, I guess, is that I wouldn't necessarily infer from that there's some hidden meaning or something important about that. So a lot of our thoughts are just complete nonsense, and we shouldn't read too much into them. Well, speaking for myself at any rate. There is a tendency, I think, for all of us to kind of walk around thinking that we see the world objectively. And that's part of bias in our thinking. It's quite a helpful bias to have. And even though, of course, I'm in this job and I talk to people about bias and their thinking all the time, I will, of course, be just as guilty as anyone else. I'll walk around thinking, the world's in a terrible state and everything's awful and London's an awful place to live. And I will think of all of that at the time as being objectively true. And of course, there may well be some truth to all of those things, but it's not the entire kind of truth. A lot of that's partly my construction of what's going on. And so, we sort of think again, like the intrusions feel like the problem because the problematic thought pops into your head or the scary thought pops into your head. But really what we focus on in therapy is the kind of construction, the meaning around that thought. And when we start to attach too much meaning to it and believing too much that it's true, or that really is how the world is, and we're seeing it in an unconstructed way.
So we know that intrusive thoughts can be irrational. Say you're on top of the Eiffel Tower and you've got a thought saying jump, for instance.
Yeah.
But why are they so emotionally powerful at the same time? Like we know categorically this is completely irrational. It's not logical. If I were to almost look at it from a bird's eye perspective, I know this is a completely stupid thought. Yet it hits me so strongly. So what's going on there?
Well, I guess, first of all, 5 people could be at the top of the Eiffel Tower, all having the same intrusion about jumping off it. And some of those 5 people might be really bothered by that intrusion and others might not. So one of the things that we think would be the case for the ones that are bothered by it is that it's emotionally salient for those particular people. So if you really value life and would be very scared about like harming yourself in some way, that might be a much more scary thought for you to have. Or if you sort of believe that people might be capable of acting on these thoughts, then the thought might seem intrinsically much more plausible, which would create that sense of threat and have the emotion attached to it. It's also worth mentioning that intrusions aren't just thoughts. For shorthand, I think we talk about intrusive thoughts, but they take lots of other forms as well. So you could have intrusive images, urges, doubts, and all of these carry a lot more of an emotional punch, really, particularly for people who've got very graphic, vivid imaginations. Fortunately, I'm not blessed with that, so I don't tend to be playing by intrusive images so much. So I think my internal world is very much like stick people walking around a bit of a stick world. But a lot of the clients I work with have very, very scary, kind of very fully developed images in their minds attached to the intrusions, and they feel very real. Also, overall, of course, we tend, I think, to attach way too much significance to thoughts and feelings. We tend to, again, have a bias whereby we think that because we've had a thought or we've had a feeling, it must be true. And in fact, that's a very poor way of judging things. If you had a court case where you're deciding if someone was a murderer or not, ideally the judge should be throwing out any evidence that's based on thoughts and feelings and focusing instead on behaviors, I guess. And we tend to underestimate the importance of behaviors and overestimate thoughts and feelings and judging whether something's important or potentially true or not.
So intrusive thoughts can occur to anyone. When is it harmful? And when can it lead to sort of anxiety and almost have this sort of debilitating effect on someone? Because I presume everyone has intrusive thoughts, but not everyone is affected or impacted so severely.
Yeah,
And so
absolutely.
what leads to that sort of anxiety?
Well, I guess the most common example of this would be OCD. And the thing that we think is really most likely to trip people up with intrusions in OCD is overestimating three aspects of intrusions. So the first element to overestimate is just because I've had this thought or this image, it could potentially be true. So overestimating the likelihood of the threat. The second aspect is overestimating the moral responsibility to react. So just because I've had this thought, it's now on me to do something about this. And if I don't, I've morally let people down or I've let myself down. And then very strongly connected to that, the third element is therefore I have to physically do something in response to these thoughts. I have to resolve the threat or kind of reduce it in some way. And of course, in stepping up to resolve the threat, what that does is activate your sense of threat, activate your anxiety, and kind of then cause you to be overly responsive and focused on the threat.
So is this more prevalent in patients with OCD, or can this happen to anyone?
Absolutely, it can happen to anyone. So in depression, we might not talk about intrusions, but you could talk about negative automatic thoughts. And again, that's when you're sort of walking around and you have a sudden thought, like I'm useless or nobody likes me. Those are really a form of intrusion in their own rights as well, too. So it's not just within OCD that we tend to experience these thoughts, but certainly for people with OCD, they cause significant problems, and of course in depression as well, too. And even outside of those particular problems, intrusions can trip anyone up once you start to sort of attach too much weight to them and assume that they're true, when in fact they may just be spammy intrusions again.
So if I've got this correct, let's say, for instance, I have an intrusive thought, I wake up and I suddenly believe that no one likes me. And so that means every time I go out, I have this perception that no one likes me. And that then reinforces this sort of negative feedback within my mind, which ultimately leads me to isolate myself in my room, and therefore I don't sort of go out and socialize. So essentially, intrusive thoughts can be these clouds, these thoughts that sort of pass by, but if you attach too much weight to them, that's when it can become sort of debilitating and harmful to yourself.
Absolutely. So, you have the intrusive thought, and on a good day, you might just shrug it off and kind of think like, well, that was an unpleasant thought, and just keep going with what you're doing. But we do have this innate bias within us to be biased in our thinking and to favor our thinking. So if we have an intrusive thought, we tend to think that it's true or might be true. And once we think that, we start to sort of look for evidence that favors our theory and ignore evidence that goes against it. So this is the idea of the prejudice model, where you're kind of looking for evidence that suits your theories and ignoring evidence that goes against it. And in doing that, again, there might be a kind of feedback loop where actually it starts to seem like the thoughts are true. So if you avoid people because you think they're not interested in you, they may then kind of not appear particularly interested in you, and that reinforces your beliefs. So there's a connection between how you act and the reinforcing of the unhelpful, intrusive thoughts, I guess.
Yeah, I guess it's a form of, let's say, sampling bias, where you feel like you need to find the evidence in order to correct yourself, almost, and say, like, I'm correct, what I'm believing is true, and so I'm going to fixate on that because it's true based on what I see and how I perceive the world. And so those intrusive thoughts are therefore altering your perception of everyone around you and the world.
And I guess the other thing that's interesting in anxiety is a lot of people will also engage in behaviors based on those thoughts. And sometimes those behaviors may become unhelpful in their own right. So, if you start riding a bicycle and you don't know how to stop, it's pretty scary when you first start. So you do what everyone does, which is you try to slow down and to cycle really slowly, and with the intention of trying to make you more stable. But of course, the unintended consequence is you become much more unstable the slower you cycle. So there's a connection again, like as in CBT, with thoughts, behaviors, and emotions.
So when someone starts to feel the anxiety and almost let them define it with who they are and make it their identity, how can they separate themselves from this sort of self-perception that they're anxious and almost reconnect with their true self?
That's a big question. I think this is all stuff that sort of takes time and work and effort. But I suppose the starting point, like when I think about what we try to sell in psychology, it's less threatening explanations for things. And so like some of the key ideas that we start with very on in therapy is sort of thinking about, is there a less threatening way of thinking about these thoughts? And is there a way of changing your relationship to the thoughts? In other words, just because you have a thought doesn't necessarily follow that it's true or completely true. And just because you have a thought doesn't necessarily follow that you need to act either morally or physically. So you're capable of having thoughts that may just be spam and don't need to be attended to. And then we start to invite people to test this out. Because again, there's a difference between knowledge and belief. So our clients can kind of academically understand that principle, but they're much less likely to believe us until they start to test it for themselves. And that's the game that kind of helpful way of trying to counter the bias around these thoughts is if you're proceeding from the assumption that they're true, it's going to narrow your range of options. Whereas if you're open to the possibility they may not be true or there may be a less threatening way of thinking about things, it expands the range of options that you have. And that kind of brings us back to the initial discussion of anxiety, I think, in the first place, which is when you're anxious and focused on a future threat, all you can see is that threat and everything else becomes very blurry in the background. And so your range of possible responses shrinks. And so what we're trying to do is to say, well, the threat may not be there. And if it's not there, there's a whole background to this that you can start to become aware of. And then that opens up lots more possibilities for how you can respond in those situations. That's, I guess, how we try to tackle that within therapy.
So do you think people give truth to these thoughts and give power to these thoughts because they can't explain why they're having their thoughts? So they're almost like, okay, this is a thought, I don't know why it's here, so I'm just going to go along with it and feed evidence to make it feel real, because I don't understand why I'm having this. It's such a unheard of irrational thought, so I'm just going to make it real in a sense.
I think in OCD that can certainly be the case. Like people will often have like urges to shout out something racist, even though they're very determinedly not sort of identifying as being racist. So that's very worrying for them. You know, pushing little old ladies in front of a train when they stood on the train platform, those kind of classic harm-based intrusions would certainly be ego dystonic, I guess, like at odds with how you see yourself. And that can really bother people that they're having these thoughts that seem anathema to how they are. But people can get tangled up with intrusions also because they seem like reality. And they seem like this is how the world actually is. People don't love me. People don't care about me. The world is a terrible place. It's all going to end in disaster. And so we can buy into those intrusions as well too, which can seem to us very much like this is how the world is and there is no exceptions to that. And again, there may be, I think like often a lot of thoughts that catch people out, there's a grain of truth in them, you know, or there can be. And so people swallow the grain of truth and they swallow the entire kind of lie with it as well. You know, there might be problems in the world today, but it doesn't mean necessarily like it's all going to end in disaster. And our bias in thinking then causes us, I guess, to swallow everything all in one go.
Do you think people are afraid to openly talk about their intrusive thoughts? And if they were to talk about it, so if I was, you know, with one of my friends and I decided to tell them, I decided to drop this weight on someone's head when I was thinking about it when I was in the gym. I wouldn't do it, but I had that thought. And do you think if we opened up more about it and we were almost bringing it to reality, like, yeah, I had this thought, then we can rationalize it in person and it would sort of go away in that sort of sense, instead of letting it stay within us and overthink and then try and rationalize it, and that could eventually lead to rumination.
So, I mean, there have been some fascinating studies done going back to 1978, I think. Rahman and De Silva were some of the first people to kind of look at whether people get intrusions and how many people get them. Their findings have been replicated by other studies since then. Seen that like the figure that jumps out to my mind is about 75% of people will say that they get intrusions. And that kind of means about 25% of people will say that they don't get intrusions or can't relate to that. Now, it's not entirely clear why that's the case. it might partly be that everyone's intrusions will be different. So it's quite hard to ask about, not everyone will be getting thoughts about shouting out racist things or kind of pushing a lot of people in front of trains. So maybe it's the way the question's been asked is different. But the other possibility, I guess, is that people either may be ashamed of the intrusions or embarrassed about them and may not want to disclose that or see them as private, or may not kind of even be that aware of what's going on internally in their own minds to be able to label these intrusions as such. So yeah, it's absolutely helpful, I think, for people to know what intrusions are and to normalize them, particularly with an OCD, but, across the board and in depression and just day-to-day living. But not everybody is going to respond, I guess, in a helpful kind of way necessarily, depending on their understanding of things. So there might be some people who end up calling the police if you disclose to them that you'd had an intrusive thought about dropping a weight on someone during gym, or kind of just maybe more concerned about your mental health in doing that. The other thing that your question brought up is that it's always really important to be aware of why you're doing something. And so you talked about rationalizing. And, again, with anxiety problems, we find rationalizing often is like digging to get out of a hole, because just so you can kind of rationalize your way out of a problem, you can also rationalize your way into it. So a lot of the work that we do doesn't entail rationalizing or trying to argue or debate your way out of things. It's more tolerating uncertainty and accepting that just because you have a thought doesn't mean the thought is real, doesn't mean that you need to respond in any kind of way.
Okay, so it's just, you just accept it, basically.
Yeah, exactly.
I think that's quite interesting, because I think we're wired to try and explain everything that sort of comes our way.
Absolutely.
I mean, we're taught that from school, right? And I guess if you over-rationalize, then that can lead to rumination.
Absolutely. So rumination is very often the attempt to resolve intrusions or to resolve the threat posed by intrusions.
Mm-hmm.
Most intrusions, the threat behind them doesn't exist, will never exist. And so there's very limited scope to what you can do with that. If you have a problem that doesn't exist and may never, there's not much practically you can do about that. So people think, well, I'll do the next best thing instead, and I'll try and think my way out of it. And of course, it's not thinking, it's worrying once you've done the first loop of the circle line and you're kind of going into further loops. And so you start ruminating very quickly, and it feels like a helpful behavior, partly again from that moral perspective we were talking about earlier. So if I can't do something practically, then the very least I could do would be to kind of invest a bit of time thinking how I could help with this. So the idea is to assuage your sort of moral sense of responsibility and also to try to resolve the issue if you can. But if it doesn't exist and may never, you just end up going on this train, going round and round and round and ruminating constantly. So the idea of acceptance and non-engagement with intrusions is very, very important.
So how does one accept it? Is it a matter of almost discipline where you need to restrain yourself from overthinking and over-rationalizing and just almost saying to yourself out loud, I've had this thought. That's it. I'm going to let it pass by, because saying that you can accept it seems easier than what it actually is, right?
Yeah, definitely. It's certainly not an easy process at all. And a lot of people really struggle not to react to their thoughts. And of course, for me personally, there'd be some thoughts that really push my buttons that I find very hard, especially if you're emotionally loaded. So if you're feeling really anxious or guilty or have very strong kind of emotions, it's going to seem much more like you have to react to these thoughts. So it's going to seem very, very difficult not to respond to them. And a lot of our language around worry, we describe ourselves as kind of passive observers in that. I find myself worrying uncontrollably, or I was beside myself with worry. And so we tend to think that we can't really do anything about it, but it is really a habit. And like a lot of habits, there are things that you can do, if not to stop it altogether, but certainly to kind of reduce the amount of time you spend worrying. And partly we do that by getting people to focus on the functionality of this. Like, what are you intending to achieve, and how successful are you being at doing that? If you're trying to resolve this issue, if you sat down for the next 3 hours and try to think your way out of it, how successful do you think you'd be with that?
What about if you don't sit down and you think about it, but you're constantly thinking about it as you're going about your day-to-day life.
Mhm.
I think a good analogy could be, say you have multiple tabs open on your Google Chrome, and that one intrusive force is a YouTube video which is playing on very low volume but on repeat. And so you're constantly feeding into that as you're, I don't know, talking to your friends or doing a piece of work. And so is it really just identifying it and being like, look, you're thinking about this, move on, and really sort of having that sort of positive self-talk?
I think that the awareness of it is very important to kind of notice that's what's happening. And I think the two halves of this are also useful to think about. So, like, if we think about intrusions as being the hook into worry and also being uncontrollable, then the tabs are going to keep popping open. You can't stop that from happening. We think the less you react to them popping open, the less likely they are to pop open. And the more you practice that and the more non-reactive you become, the less intrusions you'll get. So you'll never get rid of them completely, but you can have fewer intrusions. But that depends on your responsiveness to them. But however non-responsive you are, there will always be an uncontrollable element to the intrusion. So you're always going to walk around getting random thoughts popping up. A lot of them will just be kind of rubbish, like, I need to post that letter tomorrow. I need to remember to collect my keys. And very non-threatening and barely sort of noticeable intrusions. And some of them will be very distressing. But you can't stop yourself from getting those intrusions. So it's accepting, the acceptance that I guess is that the intrusions are going to come. But you can react, work on is how much you then attend to those thoughts and trying to mentally figure them out and ruminate and work it out. And that's the habitual side that you can do something to reduce or change. A lot of people get tangled up sort of like sort of trying to get rid of intrusions, which is intrinsically you sort of doomed to fail, and being resigned to the fact I can't do anything about worrying. Psychologists being quite oppositional people, we normally try to get people to focus the other way around, to accept the fact that you'll get intrusions and that's okay, but also that you can do something about how much you ruminate and ritualize around them.
I have a bizarre question. I've been to therapy before, and
Mhm.
with some therapists, I've sort of saw it as a time where I may have over ruminated, let's say.
Yeah.
And so I saw it more, I didn't see it as helpful, but more as a time for me to just ruminate on, let's say, an intrusive thought I had yesterday or a problem that's happened sort of 6 months ago. What do you think of that? Is that just me, or is that sort of a normal thing to say? Like, yeah, I just want your take on that.
I mean, I guess different therapists would offer, sort of answer this in different ways. My personal take on this, I guess, is that it's certainly possible for therapy to become unhelpful, with the best of intentions from clients and from the therapists. And one of the ways we try to guard against that in therapy is to have like a clear agenda and goals, and to be clear about, like, if we're going to talk about something, what are we trying to achieve from doing that? And what's the purpose of that? If you're having more kind of counseling, where it's sort of more you talk about the things that kind of occur to you at the time or that are bothering you at the time, it's a bit less structured. And there's, I guess, a slightly higher risk of that happening then, that you could end up talking about things without a particular goal in mind. And so that can become unhelpful, because then what are you trying to achieve by doing that? You may not get a resolution just from the discussion or the insight around it, I guess. Um, and quite a few of the clients that we see have had experiences of going to therapy with intrusions. And I think, like, well-meaning therapists sort of focusing on, we must get to the bottom of this. We need to get to the root, or figure out what this intrusion means or what it's actually all about. And that can be pretty unhelpful, I think, if really the intrusion is just spam and doesn't really mean very much, isn't that important, and doesn't need to be overanalyzed, then the therapy sessions can become a form of rumination themselves.
Do you think there's a fine line between venting and rumination? And I say that because if you were to say, this is complete sort of bro science, but if you were to vent about it, you sort of get it off your chest,
Mhm.
accept it and move on. But you don't want to spend too much time on it. Otherwise, you're going to be then going down this sort of rabbit hole. And so is there this sort of fine balance between acknowledging it, talking about it briefly, and then moving on, and sort of spending years on it or months on it,
Yeah.
just thinking
So I
about it.
think for me, the word venting, I guess, kind of implies sort of being annoyed,
Hmm.
being irritated by something. And you can see variations of this sort of getting irritated, getting
Hmm.
jealous, these sort of circular patterns people can go over where something's bothering them and they kind of churn it over and mull it over in different ways. Usually that's all really unhelpful. So I agree with you. Like it's helpful to sort of be aware of your thoughts and to know what's bothering you and to be open and conscious to things that are kind of causing problems for you in your head. But to churn over them and mull over them and get annoyed by them and try to solve them or rant or rage, usually those processes are going to be quite actively unhelpful for people. And again, we tend to sort of believe that there's a value to doing them. So in the same way that people who kind of scream and shout at people when they get angry, they're doing that because they think if I don't do this, people won't take me seriously. We often berate ourselves or mentally turn things over in our heads because we think this will stop things from going wrong next time or this will offer a solution. But again, it's playing into this idea that you can mentally think about things and change the outcome, even when that outcome has already occurred or when it's never going to occur. So again, it's moving away from acceptance and more onto trying to solve through churning things around, which is going to be unhelpful.
I've been playing around with this method, let's say, where I'm trying to immerse myself more in the present. And that means, going outside more, really taking in everything that comes my way. And it sounds really silly, but even acknowledging the bark on the tree or the bird sort of twitching or tweeting or whatever you call it. Do you think we consume ourselves too much in our mind, which can lead to these sort of intrusive thoughts and rumination, where we're too much inside of ourselves instead of being outside in the world, present, almost being grateful for the fact that we're here and, we can, have clean air, water, whatever. Yeah.
Yeah, certainly. Again, like I think like to have some awareness of what's going through your mind, what's happening in your life, things that are bothering you, that's certainly kind of helpful. But where people tend to kind of live very much either in the past or the future, that's usually a recipe for unhappiness. So, of course, it's a good idea to be living in the present and to be mindful and aware of the things that are happening around you. Uh, Certainly, I'm not very good at doing that myself. But it's something to aspire to, and I think it is very good for our mental health to be able to do that. And also, absolutely, to be aware that we're more than just our thoughts. So just because you're having a thought doesn't necessarily mean the thought is true. Doesn't mean that you have to react to it. Just, I guess, to almost be observers of the thoughts that we're having doesn't mean that you have to engage with them. That's a very useful way of doing that. And if you can attend to the bark on a tree or going for walks outside or what you're doing at that exact moment in the present, I'm sure that's very much a recipe for happiness.
Yeah, I think, I don't know, people can hear this a lot from me. I'm sort of big on social media and how technology could, whilst an amazing sort of benefit for us, can also possibly lead us to think about our thoughts too much and let our thoughts sort of define who we are rather than, let's say, our actions. I presume you've worked with, people who are consumed with rumination, intrusive thoughts and anxiety, which are, all different. But what separates those who break from, those sort of habits and those who are sort of stuck in those bouts of rumination and intrusion?
I mean, everyone's different, and we're not very good at guessing beforehand, predicting how well people are going to do in therapy and who's going to be able to do that successfully and who's not. I think anecdotally, there's some people who run very hot. So I don't know if you've been watching the latest White Lotus, season 3 of the White Lotus.
No,
You've seen that? Okay.
no.
So the character in it, his father was murdered when he was a child. And this has consumed him all his life. He's now in his 50s and he's determined to track down the man who did this to his father. And it's played by Walton Goggins, who's excellent. And he's kind of just seemed really agitated and kind of stressed out and constantly sort of hyper alert. And I think where people are running very hot like that with like a lot of adrenaline flowing through them and kind of just sensing threat and hyper vigilant to threat everywhere, it's really hard to be able to be less reactive to thoughts when that's kind of going on in the background. So the first step is often helping people to sort of sit more still, to relax their shoulders, to lean back against the chair, maybe take a couple of deep breaths, and then to kind of de-escalate some of that anxiety around there. And then I think people have an optimism about it and who believe that they might be able to kind of change these habits and really put the effort into sort of not engaging with the thoughts and have a bit of a skepticism towards the thoughts anyway, I think are more likely to be able to come to a better relationship with their thoughts, really.
Yes, I think positivity is definitely a skill, I think, to really acquire, especially during times of negativity. It's being able to tell yourself that there's hope and that it's okay that you're feeling like this, but as long as you're positive, then it's okay, sort of thing.
Yeah, I don't know if it's fitting here. So I've always been a bit skeptical of positivity, I suppose, but possibly more just optimism.
Okay.
Optimism that something can happen. Because positivity to me feels like often you may be trying to force something,
Uh,
whereas I guess like if you sort of fundamentally believe this might be doable or perhaps this will be hard, but I may be able to change how I relate to these thoughts. I think that's quite a helpful thing, but we may well be talking about the same thing anyway.
yeah, I think, if we were to dissect it, positivity is probably just almost delusion yourself that everything's sort of kumbaya. But optimism is more you telling yourself that, you're going to take X actions to, be better, solve it, whatnot. I think, yeah, there's two types of people, I think, in this world, optimists and pessimists. I'd like to be an optimist, we'll see. But do you think there's a correlation between, let's say, high stress people, especially those with stressful jobs or stressful lives, and intrusive thoughts? If I were to sort of plot how many intrusive thoughts you have per day, and I compared it between a very stressful person who's always in fight or flight mode and someone who's really relaxed, are they going to have probably, let's say, 10 times more intrusive
Yeah,
thoughts?
I think there's certainly a relationship between your hypervigilance for threats or looking out for threat and your reactivity to the thoughts and how many thoughts you get. So everyone gets intrusions, but some people get a lot more than others, and some people have many more negative intrusions than others. And so if you're responding to the intrusion a lot, or if you have a lot of that sort of adrenaline or kind of like poor attachment or kind of difficult things that have kind of happened to you in childhood, there's much greater chance that you'll have more intrusions and be more bothered by them and feel less able to kind of counter them or feel more of a need to kind of react to them, I think. A lot of the clients that I work with too are working in jobs where they're paid to perceive risk. So like risk mitigation specialists who are hired by banks to think of things that could go wrong with the bank and then plan accordingly. And so it's not just on the side of the intrusions and getting more intrusions, but on the valuing or being valued for thinking and kind of predicting risk and where things can go wrong. And that can be quite helpful occupationally for them. But when that moves from their jobs into their general life, that can become much more tricky.
It's almost like this is not a similar sort of comparison, but let's go with it. When I was studying physiology at the medical school at Nottingham, it was once you're exposed to all the diseases and all the problems that can go on in your body, it sort of opens your mind into, yeah, like this could happen.
Yeah. So,
And that can lead to, well, anxiety, overthinking, and the
yeah.
sort of
Yeah,
intrusive thoughts.
a lot of doctors do develop health anxiety.
I guess it's difficult to separate your job from your daily life in that sort of sense then, isn't it?
So certainly can be.
Yeah. If someone's listening to this, hopefully someone's listening to this, and they feel like they're drowning in their own thoughts, what's the first thing you'd want them to know?
Well, like, I guess the product that we sell as psychologists, the thing that we'd have in our briefcase if we went door to door trying to sell something to people would be this one key idea, which is that there's always a less threatening way of thinking about things. So our business is to sell people less threatening ways of thinking about things, and that will always exist no matter what the situation. I guess some other ideas that could be helpful is like to focus on, we tend to think that the problem is a situation, and that will often be true, but also beyond that is how I think about the situation. And we may not always be able to change situations, but we can change the way we think about the situations themselves as well. The idea too that a lot of these things are temporary and will pass, or aren't just about me as well too.
I think I've been reading a lot of Stoicism. I'm a big fan of Stoicism, and it's
That
trying.
underpins a lot of CBT.
Yes, I think it's trying to understand that the only thing that you can control is your thoughts. And
Mm-hmm.
that doesn't mean, and correct me if I'm wrong, that doesn't mean sort of controlling what thoughts come in or out, but how you sort of respond to those
Relationship
thoughts.
with them.
Yes. And yeah, it's quite, I think that sort of realization really makes you, well, realize how much little control we actually have. Right. I mean, we have the ability to interact with our thoughts and let them pass by, but we don't have that much sort of control in that sort of sense. What's the one thing you wish more people understood about anxiety and really just mental health? Like if you were to tell them,
Well, I guess really that we're a lot more than just our thoughts, which is very easy to lose sight of. We're a lot more than that. And we can change our relationship to our thoughts. And if you can manage to do that against the context of focusing on important things, self-care, doing things that give you a sense of enjoyment, achievement, socializing, that's going to be tremendously helpful for your mental health.
hmm. So I
Not sure if
guess,
that was one thing or several, but that's what I would say.
well, I guess the crux of it is to not distract yourself, but I guess just be present and immerse yourself with everyone around you and everything around you.
To be slightly skeptical of your thoughts, I guess. Just because you have a thought doesn't mean it's true. It doesn't mean it needs to be responded to. That's quite
Yeah.
a helpful idea, I think.
Yeah, I think it's falling outside of that trap that not everything that comes your way is truthful, and that it's just your mind playing games, let's say, or just being itself and being random, and you just gotta take it with a grain of salt sometimes.
Yeah, sounds good.
One more question.
So,
Finish. If we could sort of understand one truth about our minds, because our minds are very complex. And, I think one of the complexities with our mind is that we can't really see it and we can't sort of quantify it. What do you think it should be? That sort of truth that we should understand about ourselves and our minds?
I guess just that our minds are very helpful and they're amazing things, but just because a thought or a feeling feels true or seems true doesn't necessarily follow that it is. So again, that's kind of like healthy skepticism towards thoughts and feelings. Like we all think that we're not biased, and we're all massively biased and constructing our own realities all of the time. And that's both a scary thought, but also really helpful, because it means that when we're under threat and we're feeling anxious, part of that will be what we've constructed around the situation itself too. And we can do something with that once we have that skepticism and that healthy skepticism in place, I guess.
Fascinating. Fascinating. Well, Blake, thank you. Thank you. That's been
You're welcome,
super,
Aaron.
super fun. I've learned a lot. I mean, as a cell biologist, I'm very interested in sort of psychology and neuroscience. So this is a gateway drug, let's say, for me to have a better understanding of our minds and how we work. No,
Great.
super,
Well,
super fun.
it's been an absolute pleasure. Thanks very much for having me.
Yes.
Cheers, Aaron.